Okay, our final type of cryotherapy we're going to talk about is actually something that could be done without cryotherapy. We just see it most often with cryotherapy, which is intermittent compression. And intermittent compression units assist in the venous and lymphatic return, or the drainage. And they create a pressure gradient that helps force the fluid out of the interstitial tissues and into the veins and the lymph vessels by spreading that solid matter proximally towards the lymph ducts. Okay, so it essentially creates our funnel that we would create with compression wrap, but it does it intermittently. So it applies the pressure, then it releases so that the blood flow up the veins can kind of get to the next level, and then it will contract again and go. So the idea being that it sort of mimics muscular activity to help remove some of these this edema that might be in the area. So the appliance, and usually we call, the container, is usually filled with air, which we call pneumatic compression, or with chilled water, which is cryocompression, which is what we're going to focus on with our game readies. And they can either inflate as a single unit, where it all inflates at once and then deflates and all inflates at once, or it can be sequentially, where the sleeve that we put on the individual actually has chambers in it. And so the toes, if we're thinking about doing like an ankle and knee sleeve, the toes would have the water and compression in, and then that would then trigger the next level, so up by the ankle, and then the calf, and then the knee, and then it would relax back. And so it does more of a sequential type of compression. And those mechanical pressure waves force fluid within the venous system back to the heart. The lymphatic uptake in return is assisted by spreading that edema over a large area. So it kind of takes those pockets of edema and spreads it out so that it's much more likely to then generate itself into the lymph vessels. The compression units consist of a nylon appliance, or what we would call a sleeve, that is designed to fit the body parts. So foot, the ankle, half leg, half full leg, shoulders, arms, things like that. And that's connected to the unit through one or more hose. So some have two hoses where one is the in valve and one is the out valve, others that's connected within one hole. And then there's always on and off cycle that helps to assist with that milking or pumping. And that's what makes it different than those cryo cuffs I talked about, or that kind of continual cryocompression, where we don't get that pumping effect. The on-off cycles help with that milking and that pumping effect. So when external compression is applied, the gradient between the tissue's hydrostatic pressure and the capillary filtration pressure ends up being reduced. And so it encourages that reabsorption of the interstitial tissue. A second pressure gradient is then formed between the distal portion of the extremity, where there's maybe higher pressure, and this is if we're doing a sequential type of compression. So distal portion of the extremity has higher pressure, the more proximal portion has lower pressure, and that's going to force the fluids to move from that high pressure to the low pressure. And so if we elevate, that will also assist. So usually when we have these treatments, it's great to then also elevate the body part to help with that venous exchange as well. So how does this affect the injury response cycle? So again, we have kind of our schematic here. So the external intermittent compression, ideally also using cold, in our cases, creates these mechanical pressure waves that affects the venous system and the lymphatic system in kind of different ways. Venous system, it affects the capillary filtration rate. Lymphatic system, it kind of spreads all that edema out so that it's more likely to get absorbed more passively. So that increases lymphatic uptake, it increases venous uptake. We get distal to proximal pressure gradients. That moves more swelling out of the extremities, so we get microcirculation restored. We increase our range of motion because we have that decreased swelling, and both of those things should also help to decrease pain. And then as we increase range of motion, we can do more active activity, which will also help keep the swelling out of the extremity. So that's what this is really talking about, is that pressure gradient that I mentioned, and how we create this. So how is it specifically affecting all those things we talk about within the injury response process? So for edema, the circumferential and the sequential compression units increase the venous flow and reduce the amount of edema in the body part. So here's a good fact. So when we increase that range from about 90 to 100 millimeters of mercury, how we measure pressure, the venous flow accelerates to about 336% of its resting value. So pretty dramatic there. Intermittent compression may limit the formation of edema by decreasing the blood capillary filtration pressure. So it's more so about removing the edema than preventing it, but we might have some prevention because of those increased capillary filtration pressures. But it's not usually what we'd want to do in the most immediate care. Usually we're more focused on the cold and getting really good ice contact, and so then we use the ACE wrap as the compression during that immediate care. But this is for, again, a lot more of that post-immediate care edema removal. And so when we're out of the 24, 48, 72 hours, and we still have some of that edema hanging around, this helps pump that out. So blood flow is enhanced by decongesting the area, again, kind of spreading out some of that solid edema that has formed. The intermittent compression also increases the viscosity, the velocity of the blood flow, which helps vasodilate more appropriately. In range of motion, if we can reduce the edema in the area, we'll increase range of motion. Okay, so swelling of the distal joints decrease range of motion and thus decrease range of motion further, and promoting more distal swelling. And so you get stuck in that cycle of the swelling is stopping my motion is including my swelling. So we can help break that up with some intermittent compression. Pain-wise, it reduces the mechanical pressure. So basically by removing that swelling and that edema, we remove that pressure on the nerve endings, and so it decreases pain. It also reduces ischemic pain by increasing the rate of oxygen to get through there, because now we're not blocking up those oxygen channels anymore and the nutrient channels. So what are our contraindications and our precautions? We need to make sure that the patient's arterial blood supply, including their heart, their blood pressure, their vessels, all have to be in good working order. So they have to be sufficient to deliver the oxygen to the blood, oxygenated blood to the areas during the treatment. If someone is lacking those, it's not a good treatment for it. Big one too is compartment syndrome. If we suspect compartment syndrome, the last thing we want to do is increase pressure. And so we wouldn't want to do it. If someone has gangrene or peripheral vascular disease or ischemic vascular disorders or arteriosclerosis, or deep vein thrombosis or thrombophlebitis, all of these things, we wouldn't want to increase the pressure in this distal extremity because they could increase the risk of more severe issues. Congestive heart failure, pulmonary edemas. Again, we wouldn't want to put a clot and put pressure on that clot so it breaks away and goes up to the lungs or the heart. Any unhealed fractures, we wouldn't want to be putting compression on. And any unresolved joint dislocations. Obviously, if they have a dislocated joint, we don't want to put pressure on that and create that. So what's the evidence on this? The efficacy of intermittent compression for increasing the venous blood flow is widely accepted. So we heard that stat of increasing it by like 336%. But the effect of the intermittent compression on lymphedema is less. So lymphedema is actually a disorder that has more to do with, again, the heart and the circulatory system than an acute injury. And so that edema and that lymphedema sitting there can result in edema proximal to the treatment site, and the treatment of the lower extremity lymphedema with intermittent compression can cause more edema. So it's less for that, but in our cases, in our acute, it tends to work really well. Evidence does support that compression units elevation and cold do reduce edema more than cryotherapy alone. But again, in the immediate care, we prefer to focus on the cold with the ACE wrap compression because we get better cold results there. So our applications, the effects, we want to get that change in pressure to force that lymphatic and venous drainage, reduce the edema. Advantages is it takes minimal clinician time. We can hook them up to the machine, elevate them, and let the machine do the work versus us doing like a milking massage or working with them on range of motion or things like that. The disadvantages is it's a much slower rate of compression than we would get actively. So the best thing to do is if we can get active range of motion, if that's allowed with their injury and their pain level, that's going to get much better venous exchange, but this is something that can facilitate that. Indications: post-traumatic edema, post-op edema, chronic edema, venous stasis ulcers, persistent swelling due to venous insufficiency. Again, these are a little bit less specified, especially for our patient population. We see really good results in this area here. So our contraindications, I already went through those. Precautions: definitely use pain as your guide, making sure that it's not too much pressure. Pre-application steps are all our same, evaluate the injury well, match your goals, check your contraindications, prepare them psychologically. Since you are using cold in our cases, make sure you explain the 4 sensations of cold. Prepare them physically, so remove any clothing. You can put like a stocking net or like compression sleeve over the area. That helps make sure that the sleeve, the appliance of the device, stays cleaner. But otherwise, you wouldn't want bulky clothing. You wouldn't want to try to do this over jeans or something like that. Sometimes there can be some little leaks at the hose, so sometimes some toweling is acceptable. So application, again, inspect your body part, check skin sensation, apply the sleeve, get it snug but not too much pressure. Attach the sleeve to the pump, set your on-off time. So how is it going to pump? How long is it going to be on and off? Some let you set that, some don't. Some let you set your dosage as far as your pressures go. Here we go. As far as your pressures go, if that's possible to set. So for upper extremity, we're talking about 40 to 60 millimeters of mercury is best for the amount of pressure you need. If you're doing lower extremity, you can go a little bit higher, 60 to 100. Ideally, you always want to keep it less than the diastolic pressure of the person. That's especially important if you do have someone that potentially has some blood pressure issues. You'd want to keep whatever pressure below their diastolic pressure. So you might want to take their blood pressure first before you set. Length of time is typically 20 to 30 minutes. Frequency can be 2 to 3 times a day, and you can use it until the edema is resolved. Post-application, you drain everything out of the sleeve. You sanitize it, check the area, make sure you didn't create any ulcers or issues. Give them their instructions for their home and treatment. Again, you should have done a pre and post patient-oriented outcome. Document, and then maintenance, make sure you're checking your holes, your valves, and your sleeves. Again, you can cover that limb with the stockinette, which will help with the sanitation of the sleeve as well. So since we use a Game Ready, these are some Game Ready specific things. So the pressure and compression that we can set are set in levels. We can't set an actual number. We go from none to low, which is typically between 5 to 15 millimeters of mercury. It has about a 4 to 5 minute inflation with about a 1 minute deflation. Medium is about 5 to 50 millimeters of mercury. So the highest it goes is about 50, and it takes about 2 to 3 minutes to inflate with, again, about a minute of deflate. And then our high, which is 2 to 3 minutes of inflation and 1 minute of deflation, and that gets us up to 75 millimeters of mercury. So again, upper extremity wise, you might want to keep it at more of a medium. Lower extremity, you could potentially go up to the high, but ultimately you want to experience these for yourself and decide what will work for you. We can adjust the cold, so 35 to 50 degrees Fahrenheit, so your cold level you can set. The timer can be set to run continuously up to 190 minutes, but time can be specific up to about 95 minutes, so you can actually set it on off to what you want. Again, 20 to 30 minutes is usually what there is there. There are preset controls, but we don't use those. It uses what's known as the Excel, which is the active compression cold exchange loop. This there's a link to a video that you can watch, kind of that function of how the water and the oxygen supply gets stimulated from the lymphatic function. It progressively increases and releases the pressure while also rapidly circulating the ice water into 2 separate chambers. So one circulates cold water in, and at the same time another one circulates the heated water back out so that you keep at a more constant cold temperature. The compression mimics the contraction and release of the muscles, though like we said, it's never going to be as fast as an active contraction would be. It can help reduce edema, muscle spasms, pain, things like that. And the wraps that come, there's shoulder, elbow, hand, wrist, cervical thoracic spine, low back, hip, groin, articulated knee, which allows for actually range of motion while in the sleeve. So you could be doing some range of motion activity. A knee, a half leg boot, an ankle, and above and below knee amputees actually. Advantages, it's really user friendly, it's pretty portable, lightweight. There's a carrying case. Disadvantages is you need to have all the different wraps. They can actually wear out pretty quickly, especially the sleeves and the wraps. You can't set an exact pressure, which ideally we would, especially if we have someone, again, that we're concerned about blood pressure. And then how cold does it really get? So we set this temperature, but it's not going to get as cold as doing an ice bag and a ACE wrap would be. And so again, for our immediate care, we'd rather go that route. And then our maintenance with these intermittent compressions, again, just kind of following each treatment, clean the area, sanitize everything, allow after clearing for the appliance or the sleeve to dry, keep everything really neat so that the hoses don't get ripped or punctured. Quarterly, check your hoses, check the unit and clean that. Check your plug and your electrical cord, and then annually it should be serviced by a technician as well to look and inspect it. The game readies are usually a little bit less needed for that than the big devices that aren't portable, but you'd still want to do that.